Good morning. This video is to show you how to use the loaner kit to restore Neodent dental implants. If you don't have appropriate instruments in your office, the loaner kit like this is available in our office and can be reserved and delivered to your office with 24 to 48 hour notice. The loaner kit has multiple components in it. Number one, it has a torque wrench. Number two, it has a hand driver. Number three, it has a ledge driver. And then either scan body or closed tray or open tray impression coping. So those are the things you'll find in your loaner restorative kit. Possible situations you're going to be dealing with. One is an implant with healing abutment, and one is an implant with a temporary crown. So before you start the procedure, make sure you use a perio probe and clean out the hex inside the healing abutment. If you have a temporary crown, there'll be a plug with the PVS material that you can be easily removed with the perio probe. Now, following that, open up your torque wrench, and torque wrench has a latch head, and in the back it has a barrel where you can dial the appropriate amount of torque. So if you want to torque to 5 newtons per centimeter, you put it at 5, 10, 15, and so on. The latch driver kit goes into the head like this, just like any other latch driver, and locked like this. To hold it properly, you hold the barrel with your dominant hand, which is usually your right hand, and then you stabilize the head with your non-dominant, which is usually your left hand. As you can see, Neodent drivers look very similar to Straumann drivers and to Nobel drivers. However, even though they're similar, they're very different because the flutes on the Neodent driver tends to be a bit more fine. So if you use any other driver but Neodent driver on the Neodent implant, you have a chance of stripping the hex inside the abutment or inside the temporary crown, which will make the procedure a lot more difficult. So before you start, you use a perio probe and clean out the food debris and plaque from the hex inside the healing abutment. Then you use your torque wrench to unscrew the healing abutment. I typically will tighten my temporary abutments, temporary crowns and healing abutments to 15 newtons of torque. So put it at 20, hold this with your left hand and sit it positively inside the head, and then just unscrew the healing abutment. The nice thing about Neodent system is that if you position properly, the bit will lock the healing abutment like this. To unscrew the temporary crown, you remove the seal and then use the same driver to unscrew the temporary crown. It's supposed to be together, but that's okay because we did not cement it yet. Once the implants are exposed, you can observe the sulcus and measure the depth of the sulcus. You will select the restoration depending on the depth of the sulcus. To measure the depth of the sulcus, you want to use your perio probe. So here, for example, the depth of the sulcus is 3 millimeters. So if you would like to have the cosmetic result, you should use the tie base that's less than 3 millimeters in length. The die bases can be found in the Neodent catalog on page 23. They come in different heights. 0.8 millimeters, 1.5 millimeters, 2.5 millimeters, 3.5 millimeters, and 4 millimeters. So if my sulcus depth is 3 millimeters, I will either use 0.8, 1.5, or 2.5 millimeters, and so on. We recommend using original Neodent tie bases because they have a perfect fit. Yes, you can save a few dollars by using generic material components, but it will not be as tight of a fit as Neodent original parts will be, and it will void the implant warranty. If you use scanning, you will open up and position the scan body inside the implant and make sure it's locked. If you have difficulty verifying the seat of the scan body, you can take an X-ray to verify that it's fully engaged. Just hand tighten the scan body inside the implant. The nice thing about Neodent I'm using, the hex connection is the same. So from 3.5 to 4.0 to 4.3, 5.0, 6.0, or 7.0, the connection is exactly the same, and therefore you can use the scan body for same scan body for every implant diameter. If you're not scanning and you're taking impressions, your kit will have impression coping. The impression coping can be open tray like this or closed tray like this. We recommend that you use mostly open tray impressions, as inherently they are more accurate than closed tray impressions. The only time you will use a closed tray impression coping like this is when you have limited mouth opening and you're walking way in the back of the mouth, making the seating of the open tray impression pretty much impossible. So open up your impression coping, seat it inside the implant, make sure that you have a positive seat, and then hand tighten the screw. So here you're going to take an impression coping with your regular PBS material. You're going to take or here you're going to scan. Once the scan is complete, you can remove your scan body. Again, you can use your hand driver like this. Make sure it's positively seated, or you can use a torque wrench like this. Make sure it's positively seated. So again, to use a torque wrench, you have to dial the appropriate amount of torque. So for the temporary crowns and healing abutments, we usually use 15 newtons per square centimeter of torque. The final torque on the final restorations of Neodent implants is 20. So if you're delivering a final restoration, make sure you dial 20. Again, to unscrew, make sure the bit is fully seated in the screw, and then use your left hand to stabilize the head, and then using your right hand, turn the back of the barrel of the torque wrench to unscrew the retaining screw. Once you scanned or taken your impression, you can reposition the healing abutment or the temporary crown back on the implant. As you can see, the Neodent driver sits very positively and engages the hex of the healing abutment. Here I'm going to tighten it to 15 Newton per square centimeter because it's a temporary healing abutment. So dial it to 15 and stabilize, and just keep turning till you hear a click. Once you hear that click, you know you tighten to appropriate amount of torque. And when you're ready to seat your temporary crown back in after taking impressions or scanning, you repeat the same process. This is not finished temporary, so it's not cemented to the tie base, but you put the tie base, usually it's going to be one piece, you put the temporary crown into the implant and tighten to the same 15 millimeters of torque, just like we showed you before. You can start tightening with the hand driver, if you'd like this, and when it's hand tightened, then you can confirm the seat with the torque wrench. And again, you keep turning it till you hear the click. So you don't hear the click because it's not fully seated. Sometimes it's hard to engage properly, so you can use your hand driver to find out the direction of the screw. So now it's pretty much straight up and down. So make sure it's fully seated, and now you can torque it. Okay, that's torqued. So if you have any questions on how to use our loan restorative kit, or if you need to borrow any of our instruments, please call our office at 818-345-5432. And thank you for your attention.